Doctors and nurses in the LSU health system are putting down their pens, abandoning paper charts, and picking up iPads as LSU Health becomes the first statewide public health system in the U.S. to switch to electronic health records. Known as Pelican for Patient Electronic Health Information and Care Network, it will eventually reach all 500,000 patients treated annually in the LSU system.
Pelican, the project, is really a quality improvement project. In fact, it's probably the biggest healthcare quality improvement project ever undertaken in this state.
Paid for with more than $144 million in state and federal funds, LSU first began studying electronic health records as long as 10 years ago. Ultimately, Pelican will provide instantaneous secure access to medical records, including lab tests, prescriptions, treatments, and disease histories at any of LSU Health's 10 hospitals and 500 physician clinics statewide.
Any patient who comes to a system now will have access to their medical information in anywhere within our system within Louisiana. So it gives us an opportunity to actually invoke things which will lead to better patient safety, because we'll have information readily available and we won't have to worry about moving a paper chart.
Pelican is also a safety net during natural disasters. When Hurricane Katrina struck, hundreds of patients, some near death, were evacuated from flooded New Orleans hospitals. At the time, Dr. Robert Barish, a trauma expert and now chancellor of LSU Health Shreveport, was a member of a Maryland National Guard unit sent to Louisiana to help storm victims.
Often patients are very, very sick or injured and can't even tell us their medical history. And without a medical records, we have to guess, and it's a lot of detective work, and that's not what you want.
Now, every entry on a patient's record is immediately available to all caregivers.
No matter where they're from in the state, no matter what state institution they've been to in the past, when they roll into one of our ERs, we will have their information. All their x-ray reports, medications they're on, allergies, drug interactions will all be available to the physician who is treating them at the time.
Patients eventually will be able to access their own medical records online.
So the great thing about Pelican is it's one patient, one record. And so that patients, no matter where they're seen, have the same record. So whether you're seen in a cardiology clinic, in an internal medicine clinic, the doctor logs into a computer and has access to your record. So there'll be no more the medical records can't find their chart, or the chart's actually in another clinic. People just log in and have access to their complete and entire medical record.
Going digital was a huge undertaking that required more than 3,200 LSU health workers to undergo 60,000 hours of training. Initial deployment of Pelican covers LSU medical centers in North Louisiana. LSU hospitals and clinics in South Louisiana, including New Orleans, are expected to be connected to the system by next summer.
Ultimately, Pelican will increase our operational efficiency. The single entry into a single integrated database allows information to be shared by all clinicians simultaneously. So a physician can write an order, and that order is available to be acted upon by a nurse instantaneously. That really reduces the cycle time in delivering health care to our patients, and ultimately that makes us more efficient as an organization, which will reduce our costs and increase our revenues.
For one Shreveport family, November 6th also ushered in a new era in their lives. Baby Skylar Smith was born just hours after the switch to electronic health records, becoming the LSU health system's first e-baby.
It's actually a pretty good feeling, you know, you can come right here. You don't have to fill out so much paperwork, sign this, sign that. You know, you just come, give name, date of birth, and they pull everything you need right up for you.
Mother LaRonda Cooper was also born at the LSU Medical Center in Shreveport over 25 years ago. Her paper record is among the 3 large warehouses full of paper charts at LSU Health Shreveport. But that will all change for the 500,000 plus patients in the LSU health system, starting with baby Skylar.